Good morning, Dr. Russ here, and this morning we have Anthony with us who's got two areas of complaint. One is around the left upper trapezius and a little bit stiff and tight, and the other is his left hamstring, which has been a problem on and off for a few months. He is very athletic and works out pretty hard, and sometimes that left hamstring gets into a bit of an overuse situation. So I'm starting with really some gentle palpation of the vertebrae in his lower neck. So here, as he tilts his head back, I can feel C6 sliding forward and C7 staying put. So that's how I know I'm on C6, 7. And it's a little resistant to that left side bend and a little resistant to that left rotation as well. So we're going to look at C6 for an adjustment potentially. C5 and 4, moving pretty well. So as I work up his spine, one vertebra at a time, I've got one finger on the spinous process of one vertebra and one finger on the spinous of the one below. And feeling for relative movement between those two segments. And rotation at the atlas, and then at the occiput, it's extension. Let your head come back just a little bit, let your chin lift. Good. So a little stuck on the left as well at the occiput. And we know there's going to be some issues in the upper trapezius muscle right here because that's where the symptom is. And we will assess that hamstring with you laying face down. We can see and feel this is a very well-developed hamstring. There's plenty of it. And we have felt before little bits of grainy texture in the muscle that represents an area where fluid has stagnated, congested, and then consolidated a little bit. Consolidation means just what it sounds like, which is it turns kind of solid. So nice, healthy fascia is pretty homogeneous in feel, kind of like firm tofu. And when there's an area of chronic tension, it inhibits the circulation through that area. The tension keeps the blood and the lymph from moving through well. That's how you get stagnation, and that's how you get consolidation. So as I'm stroking up here, I feel nice homogeneous fascia and muscle, and the fluid moving and getting out of my way pretty easily. And then right around there is where it starts to feel stagnant. And so that's where we're going to work. Is this the issue area or is it higher?
Yeah, that's right there.
It's right there. Okay, so we found it. And we're doing some gentle mobilization. As I'm rotating from his foot, his thigh bone, his femur is rotating on the table like a rolling pin. And I'm moving the tissue in relation to the bone, getting a stretch on the deeper tissue without a lot of deep pressure. Number one, I need to save my fingers. And number two, there's really no need to cause a lot of discomfort in the patient, which is just going to make him tense up and make it harder for me to do what I need to do. But there's my spot right there. So we're going to hold a little compression there. And maybe you can see that my thumb is moving really slowly, about an inch every 10 seconds or so. Yeah. So in a situation like this, and our patient is an athlete, we know that they're going to continue to do the activity. So our job is to address the issues as they arise. So now what my finger is kind of latching onto is actually the back of the IT band and the very side and back of the vastus lateralis. Even though we're in the back of the thigh, we're on quadriceps tissue right here. And if you look up your anatomy textbook and look at the lateral thigh superficially, you'll see that really it's mostly taken up by the huge vastus lateralis muscle. So the intention here and the goal is to mobilize that fascia, decongest it so that fluid is moving through and there's no consolidation, because that congestion and consolidation will get irritated, and that's what's causing pain. Okay, so let's do another pass up the medial side of the hamstring here, adductor magnus, semimembranosus, semitendinosus. All the way down to the insertions. Since the hamstring crosses the knee, anytime there's a hamstring issue, we want to make sure the knee is moving well, which it is. It has a nice full range of motion. You can see his left hip start to come up as I bend the knee. That's a little bit of tightness in his rectus femoris muscle, but not too bad. Let's look at the sacroiliac joint right here. And what we like to do is lift and jiggle the leg and feel for play in the sacroiliac joint right here. And that feels like it's moving really well. So we're going to move on full spine. We're going to focus on the left upper trapezius, and then we're going to look at that lower cervical. Unless the patient is much taller than me, I like to stand at the head of the table and work the paraspinals this way. So there's pressure with my thumbs in the downward direction, a little traction on the pelvis, and then pressure with the heel of my hand as we come up. Getting a sense of what his whole spine is doing, also giving his brain good feedback from all of these tissues. And as I am continuing to do these strokes, I'm coming up a little farther laterally with my hands. I can feel the latissimus, the serratus, and the intercostals. Good. Breathe out here. Good. And then as you're breathing in, I'm going to come up the ribs. I really want to feel those ribs able to expand as he breathes in. Good. Breathe in out. Good. Feels great. So I see Anthony, I'd say every 3 weeks, is that right?
Yeah.
Yeah. And between that regular work and his really frequent activity, he's in really good condition. Muscles, very good condition, good circulation, and joints move really well. So this is good proactive care, which I like. So here is a trigger point right there. You see it snap under my finger. That's his levator scapula, which runs from C2-3 all the way down to the top of the shoulder blade. That's a little deeper than the upper trapezius, so we're going to work from the outside in. So on this table, which elevates and, I don't know, de-elevates, depresses, goes up and down, I can really control the height of the table. So I like this position here with the patient's upper arm draped over my thigh because it gives me a lot of control over his arm. It also gives me feedback. I can feel if he's starting to tense up because his arm is going to retract and I'll feel that pressure against my thigh. If he starts to tense up, that's when I lighten up. So that's pretty sensitive in there. Yep. Do you want me to slow down?
No.
He's good. Okay. So yeah, it's really bound up right here. Good. So this is really very much a direct mechanical approach to this layered tissue and just freeing it up, working it out. Good. Little traction through the arm. And let's mobilize that scapula. That's much better. Good. Good. Where's that snappy trigger point? Still there. Okay. That upper trapezius here distally, don't forget, if you're a body worker too, that it inserts on the front of the clavicle as well, the distal third of the clavicle, the lateral third of the clavicle. So we want to address any trigger points in the attachment there. Then that fascia blends with the deltoid down the lateral intermuscular septum to the wrist extensor. Good job keeping your arm nice and relaxed. So we're just going to give a stretch through the wrist extensor all the way through the deltoid and the upper trap and get that whole line of the arm nice and open. Good. Next stage, let's do this levator scapula. How are we going to get a little bit of a grip on that? There we go. So with my pointer, I'm actually approaching the scapula from the anterior, my left hand, and my right hand. There it is. So I've got this knot between my fingers. It's really deep. And so we don't want to squeeze really hard. We just want to engage the tissue and get some movement through there. And now let's give it a little more pressure. That's right where it starts to push back at me. And it's gentle hold on a trigger point. You can hold for a minute. You can hold less than that. The idea is to kind of squeeze it out like a sponge. Good. Let's give a little attention to the right shoulder as well. Much smoother on this side. Are you righty or lefty?
Lefty.
He's a left-hander. Okay. Okay. Yep. Really nice, smooth tissue on this side. Things moving really well. This is a nice way to address the front of the arm with the patient prone from the lateral clavicle across the deltoid down the biceps. As I'm stroking down the muscle, I'm also giving traction to the whole arm. And a nice stretch for the wrist extensor. And down we go. Good. Nice deep breath here. Beautiful. So I'm thinking we're going to turn him over to work the neck in just a minute, but before I do, I want to make sure that I haven't missed anything. So coming back through this lower trapezius on the right, and right there, right there. A little bit of a twitch response indicating a trigger point. So with that lower trapezius, it's really flat and right up against the rib, so it's not as much about a pinch as it is about just direct pressure and squeezing it against the rib below it. A lot of chiropractors mistake trigger points here for ribs being out of place, and it can really be uncomfortable for someone to try to put an adjustment through an irritable trigger point like that. So that's one of the reasons why I always do the muscle work first. Avoid those kind of errors that can be uncomfortable, and you're not going to clear out a trigger point in a muscle by adjusting the bone below it. Okay, let's get you turned over. Okay, some nice deep breaths here, Anthony. Good. In and out. Okay, so keeping with the theme of our left shoulder tension, there's some restriction here in his left clavicle where it meets the sternum. Yeah, it's good. So we're going to start skin level, work our way through the fascia. It's very thin here, and so the bone is pretty much right at the surface, but you can see his clavicle move. Here it is, as I move his arm. Yep, and we just want to make sure that we can induce nice lever type movement as well as a bit of rotation in the clavicle. And it let go really easily with like my second push on it. That's better. Good. And on the right side. Let's do that here as well. Are you still doing a lot of spinning?
Yeah.
Yeah. So cyclists leaning on their hands, they can jam up their clavicles a little bit. So we always Want to make sure those are nice and free. Good. Okay, so we're coming up to the C6-7 section here. And sometimes just with the muscle work, those segments release. So we need to check it again and see if it does need an adjustment with that resistance to left side bend and left rotation. And I think it does. And we had also noted when he was seated and doing the palpation that the left occiput felt like it wasn't moving as well as it could. So as we're working through the muscles in his neck and just gently massaging, kneading, and stretching there, I'm also feeling for that movement in his occiput. So I think we're going to start here with his left occiput. It's a little bit of a scoop forward and up with a deep breath in, okay? It's just a fingertip contact because it's a small bone and it does not need a lot of pressure in order to move. Well done. And then the C6-7 is a little bit bigger. C6 is not a huge bone, but I've got the tip of my finger against the spinous, where the spinous process meets the rest of the vertebra. I'm going to get him into that side bent, rotated, and give it that nudge home. So a lot of those cervical adjustments are just about bringing the bone into the range of motion where it's resistant and giving it a push to work through that resistance, and then you get a nice release. So now his right side, I can feel the spine moving really well underneath my hand, but I'm picking up on something right here in the musculature. Just a little bit of a knot. Yep, so let's open that, and remember we always want to know in our scalene triangle where the neurovascular bundle is. It's right there. So I'm way off it, so I know that it's safe for me to use pressure here, inducing that left rotation and stretching the fascia, mobilizing the fascia in relation to the muscle underneath. And right there, he gave a little breath, which told me there's something there. And I'm squeezing. Feels like the splenius capitis. It's pretty superficial and based on the fiber orientation as well. But it doesn't really matter which muscle it is. What matters is that we get it opened up and stretched out and moving, which we have done. So a couple of deep breaths here and out. Nice job. Good. That's your session. Thank you.